Hi, it's Chris here from Equine Dental Clinic. So I just want to do a quick update on the case that we discussed, or that I shared yesterday, about the 10-year-old quarter horse with the fractured mesial tooth root of the 308 cheek tooth. And this was a really interesting case because the client had been referred by her veterinary surgeon because the horse had been head shaking severely for 6 years. Not quite sure why it took 6 years to have a CT, but anyway, that's the history. And the veterinary surgeon noted a couple of diastemas, most notably between the 307 and 308. And the radiographs that he took also showed some abnormality, possibly a fracture of the mesial root of the 308. So the vet referred it in for a CT. And then the horse was referred to us to assess with a view to extraction of the 308 tooth. And as you can see from the image that I shared yesterday, there was indeed a very clear and linear, sort of straight, horizontal, lucent line, which looked very much like a root fracture of the 308, but there did not appear to be any other significant pathology associated with it, and there's no history of trauma. There was no mandibular swelling, there was no evidence of apical infection, there was no gas within the pulp canals. Interestingly, there did appear to be pulp tissue within the root fragment, but it did not appear to be gas, and really no sign of any kind of periodontitis. So a really interesting history, and as somebody quite rightly pointed out, there's absolutely no evidence at all from that CT that this root fracture, however it's occurred, and one assumes it must have been from some prior trauma years ago. As we all know, horses can get themselves in trouble in the field and cause themselves injuries. I saw a foal with a fractured mandible yesterday, which was a complete surprise to the owners, so these things happen all the time. So there's no reason it couldn't have been trauma, but it is certainly an unusual case. And the question is, what state is that tooth in if you assume that it has had a fracture, and is this likely to be related at all to the history of head shaking? So as was suggested yesterday by somebody, I had a long chat to the client, and I made all these points that we could do a mandibular nerve block, we could see the horse ridden, but these diagnostic tests for head shakers, they kind of rely on a repeatability of the test and of the result. So if you can guarantee that when you turn up at the vet practice for this diagnostic nerve block, if you can guarantee that the horse is going to be head shaking, a bit like you can guarantee a lame horse is going to be lame for a nerve block, then I think that's possibly fine. The next question is, are you going to use any form of sedation to do the nerve block, or are you just going to do it under a twitch? I don't like doing twitches on horses anymore. Had a couple of bad experiences with those ones that sort of suddenly explode, so kind of have a rule that we don't use twitches anymore. So you could use a short-acting sedation, but I'm not convinced that even with using, say, xylazine for temporary sedation for a nerve block, you're not going to get a subsequent relaxation of the behavior due to some after effect of the sedative. I'm not convinced that doesn't happen. So I think you want to do it without sedation. Can you do a mandibular nerve block without sedation? Probably yes, you probably can. But again, I think the problem is it's very often not a directly repeatable problem, this head shaking. It's even in cases like this that have gone for 6 years. This horse hadn't been ridden for 2 years, so we don't really know what's going to happen when it's ridden. So I said I didn't think that was going to be a suitable way of assessing this was the problem. And actually, the owner made it very clear that the reason she'd come to this clinic and had the CT, and she'd read the report from the professional specialist imaging company that stated that this was a fractured tooth and should be extracted. So the owner was very adamant in her mind that she wanted this tooth extracted. Now, I would normally be quite firm in my resolve. If I didn't feel that the tooth was necessary to be extracted, I would make a very strong case for not extracting it. But I think in this case, when we weighed everything up, there was a marked diastema, a very deep diastema, about 30 mil in depth, with real severe malodor in the mesial interproximal space, so 3078. And Actually, on the CT, there was a very slight widening of the periodontal ligament space mesially, extending down to that region of the root fracture. So overall, on balance, we decided that we would extract the tooth. Made it very clear to the owner that if we're going to see complications from a cheek tooth extraction, the mandibular 08 tooth would be very much almost the highest on the list for potential complications occurring, and also made it very clear that with diverging roots, as in this case, and at 10 years old, this would not be a straightforward extraction, or certainly had the potential for not being a straightforward extraction. And I listed all the potential complications that could occur with such an extraction. As it turned out, as you see from this video, the tooth was extracted with along with the fractured root from the mesial root tip. The distal root also fractured during extraction. This was an oral extraction, standard technique, and actually went very well, the procedure in the end, and we did not need to do any kind of surgery to remove these root fragments. So the tooth started to be delivered orally by about 10 millimeters. Then I heard this crack, which was the root fracture of the distal root. The body of the bulk of the tooth and the clinical and reserve crown were easily then extracted, leaving both root fragments in the apical aspect of the socket, and they were relatively easily extracted using flushing and suction and oroscopically guided fragment luxators. And so that actually went okay. The most difficult part was not loosening the fragments, it was actually lifting them from the very apex of the socket and just retrieving them orally. So actually that all went very well, but the most remarkable thing about this case, as you'll see from this video and from these images, is that this root fracture has completely healed. There is very smooth, hard tissue formation, a kind of dental bridge, dentine bridge, or some form of reparative dentine barrier on both sides of the root fragment, both on the root tip side and also on the reserve crown side, or the root side of the actual tooth. And this just absolutely remarkable that this tooth must have fractured and then repaired without any overt clinical signs that anybody was aware of. We know horses are very good at disguising pain and clinical signs, but what's quite remarkable is the power of teeth to heal in this way and to form these hard tissue barriers. And this is something that we're seeing all the time, something that we've discussed recently in the textbook chapter we just wrote on endodontics, that we do see this occurring with great regularity and high frequency in teeth that become diseased, both through trauma like this and also through endodontic disease. And it's something that we can use to our advantage in endodontic therapy, that if this hard tissue barrier has formed at the apex or somewhere along the pulp canal, but there's a non-vital pulp opening, for example, we can perform a restoration down to the level of that apical barrier, and it just a really great foundation for endodontic therapy. So it's absolutely fascinating to see. And a colleague of mine, Denis Verwilgen, who was in Sydney at the time, he shared with me a case that he had that was a known trauma to the same tooth, or certainly a mandibular 08. And you'll see from this image, after he extracted it, he also had the same problem, that the distal root fragment fractured during extraction. But you can see that this root that has suffered the prior trauma has actually managed to repair, but is still together. So not only did this tooth suffer a fracture, but it also repaired itself completely. So again, it shows the power of healing of dental tissue and teeth in horses. Not sure how that translates to other species, whether human teeth or other brachydont teeth or other hypsodont teeth have the same ability to repair, but certainly in horses it does seem to be absolutely remarkable, and as I say, something that we can really use to our advantage with endodontic therapy. So that's a summary of that case. I hope you find that interesting, and yeah, Look out for these cases. If you see any similar ones, do feel free to share them with us. And of course, if you'd like to see more videos like this on our YouTube channel, then do subscribe and hit the like button to show that you've enjoyed the content. Okay, thanks very much. That's all for now. We'll see you soon.